Hello, I'm Professor Khalid Khan from University of Granada in Spain. We're going to talk about preterm birth and core outcome sets for research in preterm birth. To discuss the topic with me, I have my colleague and friend, Dr. Janneke, with me today. Janneke, could you please introduce yourself?
Thank you, Khalid. My name is Janneke van het Hooft. I'm a consultant gynecologist and epidemiologist working at Amsterdam UMC.
Okay, Janneke, could you also introduce the paper we will discuss today?
So the paper is entitled A Core Outcome Set for Preterm Birth. It's a publication in the Journal of Obstetrics and Gynecology in 2016.
All right, thank you. To set the scene, could you tell us what is a core outcome set?
So the name means already that you have a set, meaning a particular number. It doesn't need to be a large set, but a number of outcomes that you find to be crucial in all research about that topic, about that disease, in this case, preterm birth. And it is important, you can show the next slide, because we have seen that in preterm birth randomized trials, all researchers measure something different and report something different. And then you have a comparison of apples with pears that you can really not compare research findings and also not combine research findings. And that's a real issue there.
All right, so I guess as the slide points out, there is issues related to heterogeneity and also to completeness of reporting.
Mhm.
This is addressed through creation of core outcome sets. Before we move on to discuss the details of your project, Janneke, could you say a few words about preterm birth?
So it's a huge problem. 1 in 10 women deliver preterm, and that's meaning that they deliver before the gestational age of 37 weeks.
And what happens if they deliver preterm or, in common language, prematurely?
So their children have can face a lot of problems on short term and also on longer term.
All right. And that is why it's important that there should be agreement on what we measure in the children born, right?
Yes.
So let's now move on directly to the paper you are going to cover today. Uh, what was the aim and how did we proceed?
So like I said, you don't want to have a comparison of apples and
Hmm.
pears in future research. So what you are going to aim for is that with researchers, patients, and important stakeholders, you have this set of outcomes. So this particular set, you say, okay, we will measure these outcomes in all future trials. And in the way we look at this in research, we think we diminish research waste and we win the jackpot by doing that.
All right. So let's see if in this case we win the jackpot or not. Tell us how the study is carried out.
The phases you can see here in the image are globally the phase you go through. So first you want to define what to measure. Um, Defining that means you need to identify first all the different outcomes that are used in previous research, but also by asking women with a particular condition, in my case, women, but it could also be, of course, men, depending on the condition, what they think are outcomes that are important, because they could be very different from what is published in the literature. An important example was in rheumatology, arthritis. They found a lot of research talking about pain, but on the end, the patients were saying it's not only pain that is important, but it's especially sleep quality and the way they sleep. So that is important in the what to measure. And then the next stage is the how to measure. So once you have defined, for example, pain or sleep is an important outcome, domain, then you need to define which instruments are there that can measure this outcome properly. And when you have done that process, you can, on the end, get consensus of both of them and have an outcome set.
What is Comet and Cosmin?
So those are the organizations that help you with the quality of this research. So the COMET website is very useful because you can look on the projects on core outcome sets that are being developed or already finished. So you can see if your idea is new or might be already been done by another research group. And they also provide methodological advice and also reporting guidelines. And the Cosmin website is useful for the how to measure stage. So they will give you advice on how to perform that process.
All right. To do the work, obviously, this cannot be done by one researcher in one department in one clinic, right?
Indeed. So you want, on the end, the implementation of your core outcome set. So if the aim is that all researchers will at least report those outcomes that are in the core outcome set, and of course they are free to report different outcomes they found to be important, but at least that minimal core outcome set should be there. Then you want to have all stakeholders that are important in the process of defining it, but also in the process of implementation. So they are, in this case, the patients, and in the case of preterm birth, we had midwives, neonatologists, obstetrician, but also the researchers who are on the end, hopefully putting this in their protocol. And it would be also advisable to have a spread worldwide. So here you can see that we were able to include not only high-income countries, but also middle high-income countries.
All right, thank you. What did you then find?
This was the final set. So as you can see, if we do interventions to mothers to prevent preterm birth, the moment that they come in their pregnancy, we take care of the mother and the baby. So by doing our interventions, we want to be sure that we get outcomes that are catching the effects on the mother. So in this case, mortality. Of course, you would say hopefully no intervention has bad impact on mortality, or it could have also potential positive impact. But at least by reporting it, we can see what the intervention has on that outcome. And infection, pre-labor rupture of membranes, and of course harm of the intervention to the mothers is defined as the mother outcome set. And then we have the baby set, which is also including mortality, but also a whole scale of different morbidities of the neonate from long term, but also on the short term.
I have a question as a researcher for you. Let's say if I'm designing a study of an intervention for preterm birth, which of these should I use for design for calculating the sample size?
So that is the idea of a core outcome set. So you don't need to use this one of these outcomes for your sample size calculation. That is much depending on your hypothesis. So you could very much put this as a secondary outcome, but the advice would be at least measure all these outcomes so that on the end you can combine these outcomes in future prospective IPD analysis or in any other combined research.
IPD implying analysis of data through systematic review and meta-analysis.
Thank you.
Okay, so once you got this created, how was it then brought to people's notice? I mean, as you identified earlier, your stakeholders came from all over the world. Presumably, the need to disseminate is also all over the world, no?
Yes, so we worked close together with researchers that were planning or actually already doing preterm birth research. So while still doing the research, they could change some of their data collection to be sure that they could also get all the core outcomes included. So those researchers we got that in our project. And we also collaborated with the Crown Initiative, which is an initiative from the journals. And actually, it is very important that the journals that publish the work also make sure that the dissemination is done. So we were able to translate it in different languages. You can see here, we translated it in Spanish and also in Chinese to make sure that all researchers on the globe were able to get these findings and use it in future research.
So we come back to the question of the jackpot. What was the outcome?
So we were happy to find that a lot of researchers were implementing the core outcome set. And of course, Crown is an initiative not only in women's health, it is an initiative also on neonatal health. And we were able to see that a lot of other core outcome sets within this Crown initiative were also being published and the uptake was good. So we got you see the scale of exponential growing of core outcome set publications and uptake. So that was positive.
All right, Janneke, thank you very much for explaining, and hopefully this will motivate others to contribute in the area of core outcome sets.
Thank you, Khalid.